Hi, this is a 5-part series. The cool thing about this is it's over 2.5 years. So I'm going to show you part 1 2.5 years ago, and I'm going to show you part 5 just last week. Check it out. Hi, this is Dr. Ace Thayer, your YouTube chiropractor, presenting the best results on YouTube. This is a video on Stacey. He has cerebral palsy. Remember, this is 2.5 years ago, this video. So we want to know by the end of the 5th video, do you like young Ace or old Ace? Do you like young Stacey or older Stacey? We'd love to hear those comments and ideas in the comment section below. This is fun. I love you guys. Check it out.
Hi, Dr. Thayer here. I'm with a special patient today. Stacey's been looking at us for about a year now on YouTube, and he doesn't pay for any goddamn ads. He's on that YouTube Red thing, whatever that shit is. I don't have ads on there, you guys know that, but he's like, do you get paid for these ads? I go, I don't know what you're talking about, because he does it for free. But anyways, I just learned about that just now. I didn't know that even existed. So, he's had cerebral palsy since he's been born, right?
Yep.
Okay, and so, just give us a little background on this. What is cerebral palsy?
So it starts in the birth canal with lack of oxygen generally, and you kind of have this constant muscle tension. You're constantly tightened up.
Your whole body.
Right.
Gotcha.
So what it does is your brain doesn't tell your muscles to relax.
Interesting. Okay, so, and you've been dealing with this for years. Tell us the doctors you've gone through over the years for this.
I've gone through physical therapy. I've gone through many different chiropractors. I've gone through general practitioners.
Any specialists? Orthopedic surgeons, neurologists, any kind of cerebral palsy specialist kind of deals?
Not really. I mean, I did have one doctor that said I wouldn't amount to much and I'd be at home for the rest of my life.
That sounds like my dad. So anyways, I'm sorry. Sorry, Dad. So you've been dealing with it for years.
Yep.
And what do you do for work? Let's do this.
I do many things. My dad.
You have to, if you want to mention the exact business you're in, you can. But really, it's kind of, are you a physical guy, right?
Yeah, somewhat. I lift heavy things for a living, and then I do computer work.
So it hasn't stopped you from living?
Nope.
Gotcha. But you want to live a better quality of life.
Right.
So why are you here since you've been to other chiropractors?
Mainly because for about 6 months I've had pain and tightness so bad that I've had to take muscle relaxers and all that sort of stuff.
Gotcha. And so he has had a chiropractor you just talked about for 8 years.
Yep.
And he's been going to this guy on and off. Tell us about that experience. And when did you go last? When was your last appointment?
It was a couple weeks ago. He would do traction. He wouldn't do any of the big adjustments. He wouldn't really fix the problem. He'd more kind of a Band-Aid type thing.
Okay, and so you told me just a minute ago, what is his purpose when he's adjusting? What did he say? What is his fear?
I don't actually know. He just, ever since I've started going to him, he's a little hands-off, if you will.
And what do you think it's caused by?
Just because I'm different, maybe.
Different, yes. And so all I'm trying to say is that I'm here to help people. The doctor that he goes to, I'm sure, is trying to help him, but he's fearful of hurting him, I guess, maybe to a certain extent. So we're going to adjust Stacey the best we can. And he, like I said, he's had this chiropractor for 8 years. He's here because he wants something different. We're going to adjust him a lot more strong, and we're going to get him better. Or at least we're going to do the best we can, okay? Mm-hmm. So you have pain down your left side here. Let's go over some of the things here. You have numbness in your fingers, right?
Yep.
And which ones?
It varies. Sometimes it's left, sometimes it's right.
But it's every day you have it, right?
Yeah, every day.
Gotcha. Headaches. How often do you have headaches?
At least 2 to 3 times a week.
Gotcha. Pain in the traps, low back pain. How often do you have that?
It's more associated with activity level.
Gotcha, but every day to a certain extent. But,
yeah.
But the left side's worse than the right. Yep. We have pain down the leg, right?
Yep.
You have pain in the front of the leg, right? When it goes on the leg, not the back of the leg. Heartburn. How often do you have heartburn?
It's almost a daily thing.
Gotcha. Ankles, knees.
Yeah.
Yeah.
A little pain.
A little pain.
Yeah.
Wrists and elbows too.
Yep.
Okay. Hammer toes.
Yep.
Okay. Let's see. Anything else? You broke your left leg.
Yeah.
Okay. When was that?
2014.
And what did you do that for? I mean, what happened again now?
I was crossing the street as a pedestrian.
That's right.
And I got
Damn pedestrians. They're in the way of these damn cars. Damn cars got in the way of this damn pedestrian, ran you over.
Yeah.
Jesus Christ.
Texting and driving is my guess.
Yeah. You're just in the way. You shouldn't be in the way.
Mm.
Yeah, anyways, I'm sorry about that. So he has some problems with left leg. He's on blood thinners for blood clots. Anything else you want to tell us?
No.
That's pretty much it, right? So I'm excited actually because I haven't really treated a lot of people with cerebral palsy, and so let's see what happens, okay? Mm-hmm. So come over here, Stacey. Okay, so let's go through the range of motions. Knees straight, bend over, touch toes best you can. Okay, you have some pain in your back or tension, what do you call that?
Yeah.
Okay, what is that, a scale of 1 to 10?
6.
6, okay. Go back, put your hands on your back, go lean back like this. What is that?
5 or 6.
5 or 6, and where's the pain, on the right side or left side or right in the middle?
Right in the middle, and then it goes actually up here.
It goes up there a lot? Okay, look at the floor with your neck, please. Any pain there at all?
Not really.
You had some tension right here, you said what was that?
4 or 5.
4 or 5. Okay, so again, he has a high pain tolerance because he's had pain since he was born. We talked about this. He has a physical therapist he's been going to, and his therapist and I both agree that he has a very high pain tolerance. Because why?
Because the technical thing is my nerves are deadened, pretty much.
No, I don't believe that. It's just that he has had this for so stinking long, he's just used to it.
Right.
Okay, so I don't know about deadened. It just hasn't been turned on, and we're going to turn it on. Okay, go and look at the ceiling. Pain there at all? Discomfort?
Mostly discomfort.
And then the right, and what scale of 1 to 10 was that one?
It's 6.
6. Okay, go ahead and step back a little bit. Good. Now, he has terrible balance. This is one of the things he talked about. So this is the thing I'm excited about because he's here for balance. Do the best you can. I know it's hard. Try to stand up on your toes, please. 15 seconds, right? Right.
It's difficult.
Okay, difficult. Good. And you could hardly do that, right?
Yeah.
Okay. Now we're gonna do this just for grins. I know. Don't fall. If you're gonna fall, don't do it. But just see what you can get. If you can go up on your heels.
Yeah.
Okay.
I'm gonna fall if I do that.
So again, we're just gonna see how you do afterwards. Okay. Okay. And last thing, we're gonna see how your knees are here. Go ahead and step back, please. Step back a little more. Okay. And just do what we talked about. Just squat as low as you can and tell me what your knees feel like.
It's more of discomfort than it turns into pain.
Okay, so discomfort the left knee more than the right, correct?
Yep.
And what scale of 1 to 10 you said it was a what on the left?
Pretty much 6.
6, okay. And then go and stand up. And that hurt when you came up in the quads, right?
And of course, the hardware that I have in there hurts when I do that.
Of course, yes. But he has hardware in his leg because he had surgery, but we like to see what happens with chiropractic. Balancing the body still helps the hardware out. Why? Because the imbalance is putting pressure on the hardware, which is making it even worse. I'm not saying we're going to take it all away, but let's see what happens, right?
Yep.
Any questions for me?
Nope.
Ready to get started?
Yep.
Good. Want to stand over here, please? Lay down over here. On your back, face up, please. So, Stacey, hands on your belly like this. So, just so you know, guys, we've already not we're not programming here. We've already pre-talked to Stacey about how he's going to get off the table because he has a lot of tics because of years and years of muscle pain and imbalance. So he has a lot of things that are in place that do a lot of bad for his body. So we already talked about how to have his body a little still, have his arms at your side, and have your head look straight ahead, right? Mm-hmm. Okay, so he's going to do that afterwards. We already talked about that. His x-rays wise. He has definite arthritis in his low back. He's been doing things badly for a lot of years. He has a little bit of a compression fracture down there in his low back. His neck, reverse curve, lots of arthritis in his upper neck. His atlas is out, lots of wear. You guys can see that on there. Balance-wise, so far imbalanced on his side posture. He's probably 30 or 40 millimeters out in front of where he should be. He hasn't seen him yet. This is the first he's heard about him. It's not that bad, dude, but it's bad. Okay, so lots of stuff to work on. Let's watch him get adjusted. So you know this already, Stacey, just relax best you can. And he's been adjusted over the years. How many chiropractors you been to?
I think 4.
Gotcha, 4. And so I'm number 5?
Yeah.
Okay. And what took you a year to come and see me, by the way?
Just because I felt okay.
Gotcha, okay, fair enough. We tend to see this on videos, on a lot of our people, not videos, but we tend to see this. People take 6 months to a year to come in and see me. We always wonder why it takes so long for you guys to come see me. Okay, so just relax best you can, okay? Okay, let this go here. Good. Okay, let this turn to the left, right? Oh, wow. Whew! He's one tough customer. That was tough.
Yeah.
Yeah, I didn't expect that. Is that more or less than usual?
It's more.
It's more, but it hardly went.
It's different.
It's different. Barely went, people. Barely. So we're going to go to the left side now. That surprised me. Okay. So I'm going to give him a little extra elbow grease on this side now. Good. Okay. A little bit more on that side, right?
Yeah, a lot more.
I'm going to do the other side one more time because I want to see if I can get a little more on this side. Come back this way. Because I was shocked how bad it was. Wow. Woo! Okay, that's all we're going to do today. That is one tough side, dude. Wow. Okay. I didn't expect that. So, anyways, back on me again. That hardly went. He has so much muscle memory in there, so much scar tissue in there, it does not want to go. So, today we did a little bit on the right, a little bit more on the left, about as poor of a start as you get. He's going to feel a difference. You guys can check out what he does. So, you'll still feel some improvement, but it'll be different.
Yeah.
Was that a little harder than your last chiropractor?
Yeah.
Okay. So just like we talked about, look straight ahead, keep your arms to your side. You want to sit up, please? Put your legs over the side. Just sit at the table here. Okay, so very basic adjustment, by the way. We didn't do the atlas. We just did the lower part of the neck. Go ahead and sit square on the table a little bit. Do you feel lightheaded at all, dizzy at all?
A little bit.
Gotcha. And you know I talked about in the video, that's because we've affected your balance centers. So you're going to walk for me and just relax best you can. Look straight ahead. Arms to your side. Go ahead and do it, please. Look straight. Don't look at the floor. Try to look straight ahead. All the way to the door, please. All the way to the door. Okay. Good. And come back here. Now, how dizzy are you right now? So
Moderate.
Moderate? Let's do
Yeah.
one more time the door then. One more time the door, please. Now you'll have to tell me how this is different for you, or if not, or if it's the same. So look at the floor, try to look straight ahead, please. Good, stop right here. Good, stop right there. Good. So you get a head of steam, don't you? You get going.
Yeah.
Okay, so tell me if you feel anything different. I'm curious.
I feel like it's straighter.
Do you really? Are you, you know, you don't have to kiss my ass because enough people out there do it already.
No.
Do you feel any different? I'm just curious.
Yeah, I feel like it's more straight. I feel like I don't lean quite as far as I used to.
We can see that, and I'm sure the camera can see that because I can see right now you're actually not twisting as much.
Right.
Because you came in, as soon as I saw him the last 2 times I saw him, he walks in. I mean, he's leaning instantly, and you're already starting to lean again. But he's way better than he was. So you feel straighter. Anything else?
Just, I still feel kind of like a head rush.
Head rush right now?
Yeah.
Okay. Breathe in your nose. That's it. Okay, one more. So you still feel a little lightheaded, a little dizzy still?
A little bit.
Let's try one more lap then. One more lap, please. Now, the reason we walk people is because the recalibration of the spine. I've affected his brainstem. I've worked on his cerebellum, which is his balance centers, and that adjustment up here is passing down through his body. So the walking helps recalibrate the spine. Okay, I'm going to stop right here. He likes to get going, man.
Yeah.
Okay, step back a little bit. Okay, let's see where you're at. I'm really curious here. Step back a little more, please. Good. So, deep breath. Okay. Any difference with the walk? I'm curious.
It just doesn't seem like I'm swaying. I usually sway this way, and
You feel like you have a little more control forward and backwards.
Yep.
Huh. It doesn't look like it does to people, but he does. It's your words, right? Okay, so let's take a look and see your back. Touch your toes, please. Okay, that was a 6 or something? I forget what you said.
Yeah, it was a 6, and there was a lot of tension there. The tension seems to be gone.
Gone or like mitigated? I mean, you tell us where you're at on a scale of 1 to 10.
It's
I want
probably
truth.
probably a 1, but it's
Again, you're not exaggerating, right?
right. It's not what I'm used to.
I'm sorry, what does that mean? You're not used to it.
I'm always used to a certain amount of tension everywhere.
Gotcha. And so, are you saying it is different?
Yeah,
Truthfully,
it is different.
because I know you're trying to make me look good because you're like, I want to befriend this guy. He's a cool chiropractor. No, none of that kind of stuff.
No.
You wouldn't lie for the camera, or just try to maybe be friends with me because you like me, because you're like, I see him on YouTube. He's such a cool guy. You wouldn't do that kind of stuff. You'd be truthful, right?
Yeah.
Good, perfect. Go and go back, please.
There's still some tightness there, but
Gotcha.
it was a 6 before, and it's like a 2.
A 2. Did I rub your back?
Nope.
Did I massage your back?
Nope.
Did I twist you at all down there?
Nope.
Did I even touch it?
Nope.
Okay, so it's different, right?
Mm-hmm.
Look at the floor, please, of your neck. How about that?
There's a little bit of tension, maybe a 1, but it's
Both are better, up and down.
It's both.
And I barely got anything on that adjustment. Barely. We just scratched the surface. Okay, so let's do the fun ones here. On your toes.
I don't feel quite as unbalanced.
Quite, meaning how much better? Look at you.
I don't.
You're a champ right now compared to before.
I don't feel like I'm gonna fall forward or backward or at all right now.
Well, let's just go out percentage-wise. How much better balance do you feel like you have? I'm kind of curious. 10, 20, 30,
60%.
60% better. You can see it. You're actually still standing on your toes.
Yeah.
You couldn't even stand on there for what? 2 seconds over there.
Right.
So again, this ain't gonna be perfect. Go down your feet. This ain't gonna be perfect, but I want to see if you can do the heels. I just want to see how long you can do it. Let's try it.
Right. I still feel like I'm gonna fall, but it's a lot easier to get further back.
Good. I'm just curious. I didn't think it was gonna be perfect, but I'm just curious the difference. Okay.
Right.
Let's check your knees up.
Not quite as much pain. It's more tightness than anything now.
Okay, you were 6 out of 10 on the left knee.
Yeah.
Where are you now?
Yeah, it's like a 3.
And there's hardware in there. There's hardware, people. How does that happen? How is that possible? How about, come on up. How about the pain coming up?
I didn't notice it except for on the left side a little bit.
A little bit. But you were 2 out of 10 before coming up. How was that? A lot less, right?
A lot less tightness, a lot less pain.
And the other thing I'm curious about, which we didn't ask, how about strength? Did that seem easier to get up and down?
Yeah, a lot easier actually.
Yeah.
I mean, I'm always used to a little bit of doing things my own way, and it kind of feels easier.
Okay. Again, not perfect, people. Tons of problems. I mean, you see how he walks? That gait is horrible, but it's better,
Yeah.
right? And we're not just putting words in your mouth, right?
No.
Good. Pretty awesome.
No.
Thank you very much for coming. Thanks for the video. I hope we can follow up with this guy. I'm excited to give him some kind of a semblance of difference and change. And again, horrible adjustment. Horrible. We got this kind of posture, this kind of results out of him. So I'm stoked. See you next video, okay?
Yep.
Good. Thank you, guys.